Okay, well, let's get started. Hello, everyone. I'm Christopher Kent, and with us today is Dr. Christie Kwon. And Dr. Kwon has been involved with the Foundation for Vertebral Subluxation in many roles for many years. She comes well-credentialed, having a master's degree from Johns Hopkins, as well as a Master of Public Health from Emory, as well as a Doctor of Chiropractic degree. So welcome.
Thank you. It's always nice to spend time with you, Dr. Kent.
Yes. Well, I'm excited to think about your presentation at the symposium. And I'd kind of like you to share some of that content with our audience so that they can see kind of what the direction you are taking in terms of a public health specialist is.
Sure. So as you mentioned, I recently completed my master's in public health at Emory University, thanks to scholarship support from the foundation. And one of the projects that I worked on during my MPH was my thesis project, focused on estimating the prevalence of vertebral subluxation in the general population. We had the good fortune Dr. Stan Pierce Jr. and his team, and we had over 3,000 patient files to filter through to do our prevalence estimates. And the reason that this work is really important is because we all do believe and like to say that everyone needs chiropractic care. And while I am in agreement with that, we don't really have any numbers to put to that to say definitively at any given point in time what percentage of the population is subluxated. And that ties into the conversation of immunity, because if we're talking about as we live our lives, as we go about interacting with the rest of the world and our environment, what challenges does our immunity face when we are subluxated? And so background to that, we need to be able to know how many people in the general population are subluxated. And so that was the focus of my talk for the immunity conference. I really enjoyed sharing some of the preliminary data at that point. And in the few months that have passed since then, we've taken some exciting steps with that manuscript. So we're waiting on the next steps of peer review with that.
Well, that's really exciting because we talk about how everyone can benefit from chiropractic care, but we've never really had any data using an operational definition to determine how many people in the population are indeed subluxated using objective criteria. So this is a very exciting first and hopefully the beginning of more along that line.
I think there's a lot of potential for more studies of this kind, greater magnitude, and just more patients, more places around the world. Where and when is always important when we're talking about the public health component about prevalence. So it's important that we're capturing data. This data set came from quite a few cities all around the country. It would be really amazing to have even international data so that we can see globally what the prevalence of subluxation is. And something that you mentioned is the operational definition. That's important and not yet done in the literature. So we all have our different flavors as far as how we like to measure the subluxation and what objective tools we prefer, maybe because of our technique or personal preference. But at the end of the day, it's really important that we're capturing not only the biomechanical component, the misalignment of the subluxation, but also neurological interference. Without capturing that neurological interference, it is simply a misalignment, and the force that you're delivering is simply manipulation. And so it's very important that when we talk about chiropractic, we're sure that we're talking about vertebral subluxation, we're talking about the chiropractic adjustment, and the specificity comes with measuring that neurological piece.
And indeed, that's something that's often overlooked in research. The importance of there being an operational definition so that we actually have something to measure, we have a benchmark. And when we're doing clinical studies, we also then have the ability to do pre and post assessments. So this is really a very exciting road that you're taking us down. Could you touch on how this relates to immunity and the whole challenge that we're facing now and how to present this to the public?
Well, anything that we want to present to the public as far as being from a public health perspective is important information that will fuel things like policy and our educational programs. And in the context of immunity, that's kind of what we're focused on because the times that we're living in. But really, it helps us give a measure of our own health potential and health status at any given time. So for me, knowing the general prevalence of subluxation around the world one day gives us this, a number to be able to estimate what percentage of humans on this earth are not maybe living to their fullest potential, and that includes in terms of immunity. And then by being able to maybe one day see a decrease in the prevalence of subluxation tied to an increase in immunity and immune function and overall well-being, maybe we can make stronger linkages to a less subluxated world being a healthier world.
Well, those are two very important concepts. The idea that we're looking at biomarkers, that we're looking at immune function rather than specific disease entities, and we're looking at the impact that vertebral subluxation has on quality of life. So do you think it's feasible to tie all of this together?
I think it's certainly feasible as far as those who are willing to listen with open ears to the data. I found that outside the chiropractic profession, people speak more the language of empirical data. And so I think these conversations can be had outside of chiropractic with stronger emphasis if we have the data to back it up. And I think, like you said, rather than focusing on any one disease process, infectious diseases come and go, but at the end of the day, the human physiology is pretty well understood. And so being able to kind of link that to the context of whether a person is subluxated or not is going to be key and fundamental, regardless of what the environment brings to us.
Well, what's also exciting, I think, is the possibility of chiropractors in the field participating in this research by contributing information. The development of a practice-based research network and the ability to, again, get a cohort that's more representative of the general population and to look at specific objective indicators of both function and quality of life. Any thoughts on that?
I would love to see more chiropractors contribute their data to a central data repository so we can have a larger and ongoing data collection process and we can continue to crunch those numbers. In an ideal world, if everyone was contributing that same data into a database, I could go at any moment, look in real time, and look at the past month or 6 months or year and make these prevalence estimates. And we can also develop a trend line to see how it might be impacting or correlating with other world events. So I think that that would be a really fascinating thing to be able to have. And then in terms of just further exploring even the data set that we have now, there's a lot of things. So people who do like advanced imaging research, for instance, with MRI, they say they can take one pixel and study that single pixel for a lifetime. And in the work that I've done so far with this data set, I feel that way as well, that we could do a lot more just with this small data set, but it would be amazing to be able to see that grow and tie it into quality of life measures as well. So incorporating something like the PROMIS surveys related to global health or the SF12 or SF36. And of course, seeing how that ties into prevalence of subluxation, as well as looking at pre and post measurements to see where the population under chiropractic care might end up over a period of time.
Well, this is amazing stuff, and we really appreciate your commitment to bringing to the world your expertise and the ability to demonstrate objectively that the prevalence of vertebral subluxation is something that we can and will be measuring. And moving forward, we have the opportunity to capture this data that's been flowing through thousands of chiropractic offices all these years and unfortunately hasn't been tapped. So this is an amazing vision that we all share at the Foundation for Vertebral Subluxation, and we really thank you for your work.
Thank you very much, Dr. Kent.